Hello and welcome to Aesthetic Beauty Centre here in Sunderland, and today we have Katie Bulmer-Cook interviewing Dr. Ashish Dutta.
Are you ready, Dr. Dutta?
I'm not worried. I'm scared because I don't know what questions are coming my way.
Well, we've got a range of anonymous questions, so let's start with the first one. Do I have to pay for my treatment all at once?
There are 2 or 3 options available. Most of the people who come for surgery, yes, we expect the money to be paid before the surgery, but they have got an option of breaking it up into small chunks. We've got a financial advising company. You can talk to them independently, and then the whole money can be paid through the company in monthly or weekly expenses. But for smaller treatments like botulinum toxin, fillers, lasers, they are so small an amount. Most of the leasing companies or loan companies, they don't want to particularly involved with lending smaller amounts. And the APR and the things are reasonable, so I explain to the patient that he can either pay everything in one go, or he can go through the finance company and then break it in small chunks.
Great, perfect. Okay, next up we have, at what age should men have Botox?
There are no fixed ages as in one particular age. Botox has got 2 advantages. One, it is not visible to the other person that you've had any treatment if it can be done with precision and delicacy. I tell my patient that whenever you think that you need it, the lines, the wrinkles are coming. You can try it. If you like it, you can continue with it. But the other advantage of botulinum toxin, or Botox in short, is that it does help to prevent the lines from coming, because you are weakening the muscle within reason without affecting any of the physiological functions of the body. And then that relaxation of the muscles reduce the appearance of the lines in the future. So it has got a future preventative effect as well.
Lovely, okay. Moving on, number 3. How many skin peels can you have in a year?
This is a pertinent question and a difficult question at the same time. Think about the skin as multiple layers. And if you have got a scar, say acne scar, which is quite deep, you need to go deeper. And if you do a deep peel in one go, the downtime, the complications, side effects, everything builds up in one go. But you can go to the same layer, bit by bit. It's as if you're taking a top layer off, then you're waiting for the skin to heal, and you keep on doing that till you reach the appropriate layer or the appropriate result. From a peel point of view, we have got the milder peels, which start from about 150 pounds to about 500 pounds. The moderate depth peels, patients would benefit from having their face numb, because it is quite uncomfortable and painful to be fair. So we block the face and then we do the medium depth peels. The downtime for that is about 5 days to 10 days. But for the full thickness peels, we talk about exoderm peels, they will start from about 3,000 to 4,000 pounds for one peel. And that you don't need anymore for a long day. You can have little touch-ups if you think that one area is just a bit weaker than the rest. But by and large, you don't need another peel for 5-10 years. And the aftercare, the way you should prepare the face before the peel, the way you should look after the face after the peel, it's crucial to its success. It's not just something you can do without consulting or counseling the patient properly. So it's a wide range. You can have multiple peels, mild peels every 3, 4, 5 weeks. And there are deeper peels which you don't need more than one.
Very good answer. So really, it's a very personal thing, isn't it?
It's an individual choice, and also nowadays the social aim is that most people don't want to be off work for too long. So the deeper peels are losing its attractiveness because of the fact that you couldn't go out of the house for about 3 or 4 weeks. In fact, if you try to go to Asda, they'll ban you after the
Okay, now the next question, I think there'll be a lot of people interested in this. What is the best fat loss treatment?
There is no best or worst. The best is diet and exercise because it helps you in many other ways. It helps you in building your muscles up, it gives you a better quality of life, your confidence, everything goes up. So I would say the best is diet, exercise, and of course not to do crash diets because they are not so good. There are medical procedures like liposuction, vasoliposuction, smart lipo or laser lipolysis, whereby you are taking some of the fat out under local or sedation or sometimes under general anesthetic, and then the patient needs to work on it. Because it's like maintaining your weight at that level. If you don't follow your diet, exercise, everything will fall apart at some stage. Then there are the newer technologies coming up. The radio frequency technologies, there are some ultrasound, we call it HIFU, which is high intensity focused ultrasound. They focus the ultrasound like sun's rays. If you put a magnifying glass and you can burn a piece of paper, but if you leave the piece of paper in the sunshine, nothing will happen. Same principle, you focus the ultrasound into one spot and you burn the fat deeper. They are all non-surgical, minimally invasive, will give you some results if you mix them with diet, exercise and other lifestyle measures. But I think if you wanted a quick result, then probably you're looking at the surgical options.
Okay. But would you say for all of those options, there's some hard work to be done
Absolutely.
by the patient as well? Okay.
Right. So.
What is the average recovery time for treatments?
The non-surgical treatments, most people will come in between their work schedule or dropping their kids off to school and coming here having the treatment and go back home. But the surgical treatments is variable. Individuals, some of them will recover quickly. I'll give you an example. You can have a facelift, and I have seen people, against my advice, may I hasten to add, has put on a scarf and gone to shop in Asda after 3 to 4 days. Not that I would recommend, but that's what they've done. On the other hand, there are some people who will take a long time to recover. But there is some guidance, and we always put it in writing. I would expect you to take 7 to 10 days off work after a face and neck, 7 to 10 days off after an eye lift or blepharoplasty. Liposuction, the vaser ones, although we are trying to say as it is a minimal invasive ones, but I also add that it is a surgical procedure. You need to respect the procedure, look after yourself, and then you get the best possible outcome rather than just think you're going to do it and then next day you'll be fine. Very rarely that happens.
So always listen to the aftercare advice, yeah?
Much more important than anything else.
Okay, next up. How can we avoid, I want to know the answer to this. How can we avoid our skin aging?
That's the inevitable question, isn't it? We are all looking for a quick answer, how we can look better, fresher. I think the answer lies in the society that we are in. We are a lot more affluent than what our parents were. Oh, by and large. We are living longer. 20 years ago, average life expectancy was 5 or 10 years less. And the children who are born today, their life expectancy is over 90. So we are living longer. And the other unfortunate thing is, over a certain age, our divorce rates and everything is going up. So in our mid-40s, early 50s, we are looking for partners, which makes us think that we need to look and feel younger. So there is a society is the answer. We need to move away from that by giving the confidence to the patient that you actually look alright. If you want a little bit of help, sun protection, make sure that your lifestyle measures, smoking, drinking, a little bit of exercise, average vitamin intake. As we know, in the UK, 30 to 40% of average Caucasian patients are vitamin D deficient. 70% or even more of the Asian population is vitamin D deficient. So we need to correct those deficiencies and get the most out of it, because vitamin D has got an effect on bone, how we age, diabetes, and many other anti-cancer. These are the small things we can tweak without going into any medical intervention. As a clinic, we always promote that medical intervention, as in cosmetic surgery or even cosmetic medicine, should be running parallel to to your own health situation.
So, similar to your response to a previous question, people shouldn't see procedures as a quick fix. The patient's got to work hard in addition. Would that be right?
Absolutely. If you say that it's a quick fix, you are demeaning the medical procedure itself. You need to give the patient that concept that this is medicine. And that's where the previous one of the questions which was asked is, what about the beauticians? I have nothing against beauticians. I have nothing against anybody who wants to do it. As long as they're properly trained, as long as they're doing it properly, they're taking the patient's safety into account, delivering the treatment after getting proper training, that's fine.
And train the patient as an individual as well.
Important, more important than anything else.
Okay, next up, how does VASA work? Is that the right word?
Absolutely.
Yeah.
Probably one of the questions before was, what are the types of liposuction or fat reducing procedures? And VASA is one of them. There are many procedures. We are one of the very few clinics in the UK. In fact, outside London, we are the only clinic, as far as I know, who have VASA, which is ultrasound guided or ultrasound assisted liposuction, which is the body type, which is the radio frequency assisted liposuction. We also have the vibro-lipo, and we are also looking into acquiring the water jet. I've trained in it, but we don't have the machine. VASA is ultrasound which heats the fat up, which breaks the fat cells and helps you to suck it out. But let me take you through one concept. You must have seen Michelangelo's creation. If I give you a gold-plated hammer and chisel, do you think you will be able to create me David or one of the beautiful architectures they've done? You need to know how to create something. Then if I give you a better quality hammer and chisel, you'll probably be able to do a better job. I think most of these sales pitches are from clinics who want to get a bit quick reputation, few number of patients, etc. The truth is, you need to know how to do liposuction first. You need to understand the anatomy of the patient first. Even more important, you need to understand the mindset of the patient first. That is done through consultation. You understand the patient, then you do VASA, which is ultrasound guided liposuction, and then you get the right result. It should be the right result for the right patient by the right person who is trained in it, and at the right time, because sometimes you do it at the wrong time. Patients are in a hurry. I'm getting married in 3 months, can you do me VASA? You are actually making the patient feel much more anxious. What happens if there's a complication? Can you imagine? The patient is now waiting for his wedding in 12 weeks and he managed to give the patient a complication. So it should be a completely relaxed atmosphere, no pressure on the patient, and the patients need to be aware of all the complications, because everything we do, or I do, I don't know the other clinics and other surgeons, everything I do has complications. And the way I say to my patients is, complications happen in these hands, and I need to make you aware that I'll look after you, and then the patients understand they're going to get a good quality care.
Perfect. Okay, next question is, which treatment has the greatest impact, I want to know the answer to this personally as well, to improve lines and wrinkles?
There are non-surgical, surgical, and some minimally invasive treatments that we can do. There's no best treatment. Again, the answer is, if you start with by looking after your skin properly, sun protection, lifestyle measures, and then when you really need it, then start having a little bit of Botox and fillers, just minimal invasive procedures, so that you're not wasting too much of your time. Then you can do some of the laser treatments, so the non-surgical, as in non-invasive laser treatments, like the IPL, 595M lights type of lasers. They give you the collagenation, helps you build up, and then the mild appeals. And then when you're really needing it, by the time you are probably mid-40s, then you are thinking of something more like laser resurfacing, deeper peels, and surgery probably a bit later. But there is no hard and fast rules, because I've seen 65-year-olds looking like 45, and I've seen 45-year-olds who are looking 65. So again, the same right answer is patients first. You do the patients, consultation, you understand the patients, what they are asking for, then you decide with the patient what they want.
Very personal. Okay, next question. Does surgery hurt?
It never hurts me. Surgery should be looked at that it is going to be just easy. All surgeries hurt in some way, financially and physically. I think the right answer should be prepare the patient. There are some surgeries which are really painful. Abdominoplasties, breast lifts, recovery is longer, and the more time you can give to the patient at the beginning consultation, pre-op, etc., you get a better outcome because the patient is prepared. If you don't prepare the patient and they get a shock, then you are hiding too much. Patients will find it very, very uncomfortable.
Okay. Just a few more left. The next one is, how does PRP help with the hair growth? So first of all, for my benefit, what is PRP?
I think it's for my benefit as well. I did PRP in my chest, and I'm going to show you. I've got so much hair on my chest, I don't know what I'm doing in my head. But on a serious note, PRP works by increasing the body's own response. When you cut yourself, you bleed a bit. And that's body's own mechanism to bring in the plasma, which has got the platelets and the growth factors to help the healing process. Now, when we are doing a, say, facelift or a blepharoplasty, if you add a little bit of PRP to the wound surface, we know that it heals quicker, the scar is better. The similar principle you could apply for hair. Now, when the hair is going downhill, for men it's mostly dihydrotestosterone independent and dependent hair that makes a difference. In ladies, there are hormonal changes, age, and other things that also come to be. The PRP works by increasing the protein content. Its plasma is your plasma, it's autologous. It's got the protein, it's got the growth factors which help the hair cells, hair follicles to grow. But don't expect miracles from it. We know that PRP works in about 40 to 50% of people, and in a large proportion of the population it doesn't help that much. But what I have found is most of the patients will come back and say, my rate of hair loss has slowed down. But if you sell PRP as, I'm going to do PRP and you've got a head full of hair, that's probably not the right way to do it. On the other hand, we've also seen when you do a hair transplant, if you do PRP alongside with it before and a few weeks after, you do seem to get a better recovery and a better result.
Okay. I believe there was only one more question left in the box.
Thank God for that.
But it has two questions on it.
Killer.
What is the most popular male treatment and what is the most popular female treatment? Start with the male.
Both of them are probably the same, and you'll be probably surprised to know in the non-surgical it is still Botox.
Really?
You would have expected laser hair removal or liposuction. For non-surgical, for both male and female, it is Botox. And for surgical, in the northeast, in London is different. In London, for ladies is breast augmentation, and for men it is liposuction. In the northeast, probably both is liposuction. So there is a regional difference.
Okay.
I do between 4 to 5 laser stroke liposuction procedures a week. My experience is London patients' expectation, the population is slightly different from the northeast population. There is a north-south divide even in cosmetic surgery.
Well, the box is empty, but one final question from me. Having watched this video, if people want to find out more about the procedures that you do and what you do at the clinic, what should they do?
They can visit our website, which is www.aestheticbeautycenter.co.uk. We are always here, happy to discuss things with our patients on the phone, and the phone number to ring is 0191 273 9339. But the best way to find out is to attend for a consultation, because you cannot, all these Skype consultations, Facebook consultations are there for a face-to-face consultation for a surgical or a non-surgical procedure, particularly such a close to heart surgery, cosmetic surgery. You really need to have that input and you need to feel for the patient. You cannot do that without a face-to-face consultation.
Dr. Dutta, thank you again for being brilliant.